Hi, good afternoon. Welcome to another session with Diabetes Consults. Welcome. We're excited to have you here. If you're logging in later on or you're going to watch this video afterwards, we're still saying a welcome to you. Today, we are going to be tackling another topic that is somewhat linked to diabetes or can be one of the things that we don't know, we would listen to it. Does it cause diabetes? And does it cause atrial fibrillation, diabetes or not? And we have the amazing Dr. Yeyenta, PhD, who's a clinical pharmacist with many years of experience working in the community sector, as well as primary care in the NHS. Her work focuses on stroke prevention, and she has a PhD in optimizing anticoagulant therapy in elderly patients with atrial fibrillation. That's a mouthful. She's a National Population Public Health Fellow, and her current work focuses on reducing health inequalities and preventing ill health, especially in the underserved population. Did I get it all right? Yes. Hi, Yeyenta. Thank you so much for obviously taking time out to come out today to talk to us about atrial fibrillation. Is there anything else we need to know about you that I haven't covered at all?
Well, no, but thank you for having me. I'm really excited to be here. I think you've covered it all, other than that I'm a wife and a mother, so life is busy.
Yeah, so I guess if we see any children popping in like mine, we just, it's the life of COVID, so we just have to accept it the way it is.
Yeah, I think you're welcome to accept that, children and everything else happen in between, in between work and play, so it's fine.
Yeah, that's good. So like I said earlier, thank you so much for coming on board. So today we're going to be talking about atrial fibrillation. Can you just tell us what it is?
Okay.
What is atrial fibrillation?
Atrial fibrillation, as you say, it's a mouthful. So in simple terms, it's just, it's a heart condition, basically, okay? And it is, the way that it presents sometimes is the way that the heart beats. So sometimes you notice that your heart is beating at a very fast rate, or it feels like your heart is skipping a bit. So if you want me to go further, I'd explain more how it actually happens and what it means.
Yes, please. Yes. Okay. In simple terms, so that people, our listeners who are not clinicians, can actually understand it.
Okay, so I'll start it this way. So the heart itself is a pumping machine, okay? So the heart pumps blood around the body, okay? It receives blood and then it sends out blood out again. So what happens is that there is something called a sinus node, and that's where an electric impulse, and an electric it's like a kickstart of the heart, that heartbeat that you hear. So I'd like to liken it to a matchstick.
Okay.
So you see the way that you light a match and it gives a little spark before the fire. So think about that electrical impulse that I've mentioned. Think about it as that little spark. Okay. That happens within a few seconds before the actual heartbeat. And the actual heartbeat is, so what happens is you have the little spark that then creates that electrical impulse into the body, into the heart, into the other parts of the heart. And remember that I've said that the heart is a pumping machine.
Yeah.
It has 4 chambers. So it has 4 main parts, okay? It's a big muscle that contracts. And when I mean contracts, it squeezes itself, okay? And with that squeeze, blood is sent out. And then it squeezes again and blood is sent out. And with each squeeze, that's a heartbeat. All right. Is that clear enough?
That's clear for me. Yeah.
So when you then have the initial spark, it sends what we call an impulse or signal to the other parts, to the other chambers, the other parts of the heart, which is the lower one. So the spark starts from what we call the Atrial Node. Okay, and we have the four parts of the heart. We have the atria, which are the top two chambers, and we have the ventricles, which are the two bottom chambers. I'm not going to go into too much anatomy just for simplicity. Okay, so when we have that initial spark, it sends a certain force or a message to the other ventricles, the other lower two chambers, to squeeze and to contract, or to squeeze and push blood back out of the heart and into the body. Now, what happens in atrial fibrillation is that that spark, which happens periodically, goes to then becomes more erratic or has a mind of its own, and either goes or it goes and then pauses, and then and pauses again, and so with each pause is a skipped heartbeat. Okay. Now, when that happens, then the heart gets a bit confused, the muscles, because they're not contracting the way that they're meant to be contracting, or the way that they're meant to be squeezing and pushing that blood out of the heart. So when you have that kind of erratic, beat, what then happens is that the blood, instead of being pumped out of the heart at periodic frequency, the blood then pools. So what I mean by it pools is that the blood gathers, okay? And the blood would gather at the left, the left atrium, and rather than being able to move, a blood clot can form at that part of the heart, and that's the blood clot that can either go into another part of the heart and cause what we call myocardial infarction, or it can cause a stroke if it goes up into the brain. So atrial fibrillation basically is that kind of, we call it either a flutter or an erratic heartbeat. It can also be known as palpitations, or it could be a skipped heartbeat. Sometimes people notice it, they feel that their heart is beating so fast without them being scared or anxious. There is no real reason. They just notice a really rapid, fast heartbeat. Some other people would notice that it feels like their pulse is skipping or their heart is missing a beat. So there are two ways that it can happen. It can be either very rapid, or it can be no, maybe not rapid, but irregular. So instead of beating at a regular pace, it beats at an irregular pace.
Okay, thank you. That's very, well, as simplistic. There's some medical terms that you cannot simplify, well, you can simplify, but it's not just as simple as you want it to be. But I think you did a fine job in actually simplifying what it is, because a lot of people go, what are you talking about, atrial fibrillation? But I guess it's really thinking about the things that can possibly lead to strokes or major heart conditions. So thank you for doing that, going through that for me. Now, is there anything, is there any cause for this atrial fibrillation? Is there anything that's causing it? Or if there's no cause, are there things that what we call increase the risk factors for getting atrial fibrillation?
Yeah, well, sometimes simple things can cause atrial fibrillation. By what I mean simple things, I mean like a common infection. Okay, somebody could have an infection within their body, and it causes their heart to behave in that way. Now, all you have to do then is to get the right medical treatment. The doctor gives you the right antibiotic, you treat the infection, the atrial fibrillation goes away. Okay. Other times, people with thyroid disease can also have atrial fibrillation caused by overactivity of the thyroid gland. Again, just like the infection, you get good medical treatment. You have the right medication for your thyroid disease, and then the atrial fibrillation goes away. Okay, so those are two common examples where there can be a cause, there can be an underlying cause for the atrial fibrillation. But for most other people, the cause is more caused by so many different factors or so many different things that put the people at risk of developing atrial fibrillation. Okay, so there may not be any specific cause per se. So we might have rather risk factors. So for example, ethnicity might be a risk factor. We know that at least 1 in 3 people who are of white or Caucasian origin would have atrial fibrillation as they age or they go older. So at least from the age of 65 and over. 1 in 5 people from African or Asian origin would have or develop symptoms of atrial fibrillation. Okay, but this risk of developing this heart condition increases as we get older. And this risk increases even more greatly as you get to the age of 65 and over. Okay.
Is there a cause for, so you said that the risk increases as one gets older. What, I'm intrigued to know, what about the age increase that leads to the risk of atrial fibrillation becoming higher?
Sorry, so can you repeat that question again?
So in your statement, you said that the risk of atrial fibrillation is increased as we get older. Mm-hmm. Now, is there any particular thing, apart from obviously age, why is it linked to age? Is there a reason?
Yeah, it could be. It could be a risk of, developing what we call non-communicable diseases. So as we get older, we acquire a lot of other, we've kind of acquired a lot of other things along the way, okay? Mm-hmm. So such things could be, for example, diabetes. So sometimes people who have diabetes have a risk of developing atrial fibrillation. It could be that the heart has become a bit more tired, a bit more frail, and they have a developing heart failure. The heart is not working as well as it should be. And mm-hmm. That happens with age, and therefore you become older. So certain lifestyle conditions, lifestyle factors would lead to atrial fibrillation. It could also be things like having chronic kidney disease. Again, it's rare that people with kidney disease, it's rare that people have kidney disease in their younger age. It's not impossible, but it's less common. So with increasing age, but now we see people even in their 30s and in their 40s and even 20s actually having chronic kidney disease. But I'll go on to touch upon that later. I don't know if you want to make a note to remind me later about that.
I'm making a note at the moment, yeah.
because actually what happens there is, so what I'm trying to talk about is lifestyle factors, and that's what my current work is about. So we're talking about more preventative measures to ill health, rather than trying to treat when people are already ill. So it would be a lot better, a lot easier if we could prevent ourselves from getting into that state in the first place. Things like being physically active. So we know that having moderate physical activity helps to reduce your risk of all these diseases, the heart attack, the stroke, the diabetes, but that's because your whole person, your whole self tends to be a lot more active and able to deal with things. Okay, so these are the things that cause the atrial fibrillation to increase with age. But also we have people who are less than 65 who still develop atrial fibrillation.
Okay, thank you. You've obviously explained it quite extensively as best as possible. Right. So you touched a little bit about this, and you talked about people actually feeling their heart skip. Are there any other symptoms of atrial fibrillation that, that one needs to know about?
So it's mainly the skipping heart or the very rapid heartbeat. Those are the main symptoms. So I've spoken to a lot of patients who actually go about their daily life without knowing that anything is wrong. For so many people, like I was explaining earlier, during my research, I spoke to so many patients who didn't even know that they had atrial fibrillation. And that in itself is a factor to how people respond to treatment or respond to looking after themselves, I should say, rather than treatment, because atrial fibrillation in itself is not it's not what causes, puts somebody's life at risk. It's the complications that happen afterwards. Okay. So for example, you may have atrial fibrillation, as I say, and you may just carry on along without realizing that something is wrong or that you're about to have a stroke. Okay. But what happens is sometimes people get not accidentally, they get diagnosed when they are going for another routine checkup for their heart or something. And then their pulse is checked, and then the doctor thinks, oh, that pulse is a bit too high, it's a bit too fast. Or the doctor might feel, I think I'm missing, there's some beats missing. And then they go on to have further tests. So the main test that people would be asked to go for in the hospital on these days, even in the GP practice, is the ECG, where they put leads on you, on your chest, and then they'll be able to get a reading to see how your heart is beating and how the blood is flowing through the chambers of your heart.
You've actually gone and answered my next question, because I was going to ask you how it's diagnosed. Obviously, we use ECG, and then if the ECG shows that there is an atrial fibrillation, they might go ahead, if they're suspicious of any other thing, to probably do things like what we call an echocardiogram, which is obviously a picture of the heart. Funny enough, I had an event with a patient just gone on Thursday, which I'll share later on as my ending cap. So it's really good to know that if your heart rate is a lot faster, especially if you wear things like a Fitbit, is there any particular, because a lot of people wear Fitbits at the moment, and they don't need to count their steps. But these days we're finding that people either beginning to notice that their heart rate's a lot faster when they're probably sitting down. Is there a particular heart rate that, if people wear a Fitbit, for example, should make them feel like I need to actually speak to someone about my heart rate, a resting heart rate, not when you're active? Is there what heart rate is it actually diagnosed?
So if your heart rate is more than like 100 beats per minute, there are people, with the heart rate, the normal heart rate is between 60 to 100 beats per minute. Okay, there are people who have just a normal resting faster heart rate, and there are people with more average of about 60 beats per minute. But if at rest you find your heart rate is really high, or you're wearing a Fitbit and it's, I would say even 80, get it checked out. But normally I would, the recommendation about 100 beats per minute. If it's faster than that, then definitely get yourself checked out. If your heart rate is at rest, you've not been exercising, you've not been doing any vigorous activity, definitely go and get yourself checked out. Some people also notice with the increased heart rate, they feel breathless, feel a bit lightheaded or woozy. That can also mean that oxygen is not being passed around your body properly as it should be. So that could also be another sign. But as I say, many people don't actually realize that they have atrial fibrillation, and they just carry on as normal. And that's where the risk is, because if you don't know your numbers and know what's important and how to check yourself, because you could also check your pulse yourself and just have a feel of your pulse and see how your heart is beating, so it's really important to be self-aware and take ownership of our own health and our own, the way that our body is ticking and everything about us. So that's a really good tip I would give to everybody, to not just wait for the doctors to diagnose you, take an interest in your own health. And I can see from people being here anyway, I know the people are obviously interested in knowing about their own health. Another thing I almost forgot to mention is hypertension. Hypertension is also another risk factor, for developing atrial fibrillation, just like, and developing stroke as well. So what happens is with the link to developing a stroke is strongly linked to things like having hypertension, having chronic kidney disease, having other heart conditions such as angina, and quite some link as well to having diabetes too.
Okay, so I'm guessing that because they're linked to angina, because I do have a few people that would say, my doctor's giving me medication for hypertension, and they don't want to take their medicine, or diabetes. How is there, I'm a clinician, so I'm trying to find a way in which we will simplify this for people, apart from screaming, take your medication, like even when you're trusting God as a Christian, take your medication, please. Is there any way in which, how does hypertension or diabetes, I know they're different topics, increase the risk factor? Is it like if someone, so what I'm trying to say is, for example, someone's got hypertension and they're taking their medication, does that still increase, and their medication controls their blood pressure, does that still increase their risk? Or are we talking about hypertension that is untreated and diabetes as well?
Yes, we're talking about uncontrolled hypertension, okay, and uncontrolled diabetes, of course. But what happens is I've seen a lot of people who have said, especially, when people are really being religious and say, oh, I've checked my blood pressure and it's now fine, so I don't need to take my medication. Actually, it could be that you were taking your medication, excuse me, and then that's why your blood pressure came down. And because hypertension and even atrial fibrillation are things that normally you may not have any symptoms. I've met patients who've told me that they know when their hypertension is worse because they have a headache or, but that's not actually always the case. In the main, there is no symptom. You can't normally tell that your blood pressure is higher than it should be. And also, for many people, you can't tell that you have atrial fibrillation. So you just, go about your daily life. So I would really strongly recommend and advise people, please do take your medication, even if you feel well. And if you have these palpitations and your doctor's giving you an anticoagulant, which is the medication used to control or prevent you from having a stroke, please do take it. Because I've had patients who've said to me, well, actually these medicines, I don't actually know what they do for me. I still feel the same way when I don't take them as when I do take them. So what's the point? The point of taking your medicines when you have atrial fibrillation or when you have hypertension is for a preventative purpose, and the prevention is from having a stroke. Now, why that's more important for people with atrial fibrillation is that the severity of the stroke suffered by people with atrial fibrillation is a lot more severe than people who just suffer a stroke without an underlying atrial fibrillation cause. So that's why it's really important. And, and people can go on to have a stroke and live very debilitating, disabled lives for as long as 20 years, and sometimes longer. And it's a real burden. So, you would do well really to make sure that you're taking your medicine, but even better, to do all the preventative things that we could do to prevent us from developing these diseases in the first place.
Thank you. You talked about earlier on, you talked about exercise, trying to exercise. Now we've covered a little bit about the treatment. How do people prevent this atrial fibrillation from possibly happening? You may have answered it before, but I've noticed we've had a few people log in whilst the session has been on.
Okay, so exercise, really, I did talk about moderate exercise. The reason why I'm trying to differentiate moderate from vigorous activities, that there have been also some evidence or research to show that vigorous exercise, some people who like take on, you know, quite extreme sports or high intensity exercise can sometimes put more strain on their heart, and it can also link to having atrial fibrillation or rapid heartbeat. So it's really important to make sure that what we're doing on the whole is for moderate physical activity on the whole. So as little as 20 minutes walk a day, okay, for 5 days a week is all you need. 5 days a week, doing maybe instead of taking a bus or getting a ride in the car, or if you already walk to work. So I was speaking to one of my someone last week who was asking me about advice about physical activity and how they could increase their physical activity because they already walk to work anyway. I said, well, you could use a longer route. And the good thing about physical activity, sometimes I like to call it physical activity rather than exercise, because when you say exercise, it puts a psychological barrier in the mind for people to think, oh, it's hard work. You know, I now need to register with the gym and I haven't got money for the gym, or it's an effort to go to the gym, you know, etc. But actually, physical activity just means doing a little bit more movement than you already do. And what I advise people is try and make it, incorporate it into your lifestyle. Let it be something that you can actually achieve. So if it means walking to work, as I say, then walk. 20 minutes a day is good enough. Obviously, in addition to watching how much your portions, so how much you eat or how often you eat, that's also really important. But physical activity and doing that is really important to help the heart beat, and help keeps the heart strong, keeps your lungs strong as well, because you breathe in deeply, a bit more, and the entire body basically works a lot better that way, you know. So being active is really important, but keep it moderate, pace yourself. Don't overdo it, because you want to make it sustainable so that it's something that you can, it is then your lifestyle. You know, back in the day when we were in, when we weren't as modernized and everything wasn't fast paced and high tech as it was, we would walk to places, we would do more physical activity. But these days, everything is easy for us. And in fact,
in the car.
things are made so easy, it's almost as though we're being encouraged to sit down. And for some of us, you know, and the higher you go up in your career or in life, basically, you know, you get jobs that make you sit down from morning till evening. You come back home, you sit down, you watch TV, you go to bed. And when you actually think about how much you have spent, how much of your day you have spent sitting down, you know, that in itself, it's an epidemic, you know, that it's a real challenge to overcome. So reminding ourselves that we need to move a bit more. You know, you don't necessarily need to register at the gym, but you can do things in your day to help you to become a bit more active than you would normally be.
Okay, thank you so much. I've got one or two more questions, and I have put in the chat box. If anyone has got any questions, please use the chat box and drop your questions in there. We'll try to answer it. Now, initially you mentioned at the start that there's some causes of atrial fibrillation, things that could lead to atrial fibrillation. For example, someone had an infection or thyroid disease, but then obviously when they're given antibiotics to clear the infection or medication for the thyroid disease to correct itself, does that then put that individual at a higher risk of getting the atrial fibrillation again?
No, not necessarily, because in that case, the cause for that particular abnormal heart rate was the infection or was the thyroid disease. So once that underlying cause is treated, then that's fine. But where we have an issue is where the atrial fibrillation is not of any of those causes. It's more to do with lifestyle changes. Basically, to be pretty frank with us, our modern lifestyle puts us all at risk of developing atrial fibrillation. And if you think about it, if 1 in 3 people at the age of 65 will develop atrial fibrillation, that's 1 in 3 white people, or 1 in 5 Black or Asian people are likely to develop atrial fibrillation. That means that if you were to stand in a room with 5 other people like you, 1 out of 5 would have atrial fibrillation, and therefore 1 out of 5 is at a higher risk of developing stroke. So if you increase that number, say you're 20 in the room, 5 out of 20 will develop, is very likely to develop stroke. And it's not just any stroke, it's debilitating stroke, because it's a stroke caused by atrial fibrillation. And most times people with atrial fibrillation already have, as we have already discussed, underlying factors such as diabetes, or they would have hypertension, or they would have chronic kidney disease. So it's really important to make sure that we are looking more at our lifestyle factors, how we are living our lives up until then. So we don't want to wait until we are 65 to make lifestyle changes. You want to make those lifestyle changes now, because that's your investment for your, that's basically you're putting in that's your pension. You know, when we all work and we put aside money for our pension, think about it that when you are doing your physical activity, when you're eating right and we're looking after your health, you know your numbers, you know what your hypertension, your blood pressure number, normal blood pressure reading should be. You know what body weight you're trying to achieve. You know what, you know, things like that. If you know your numbers, those are the things that you are putting down in a health economy. When I say, you know, this is your health bank account now. Those are the things that you're doing for your pensionable age at 65. So you don't want to get to age 65 and start thinking about your health. You want to prevent that from happening by doing all these things now.
I like that. I was just writing it down. That's going to be my caption next. What you depositing into your health bank account. You know, obviously what you deposit is what you're going to get at the end. Hopefully, I've just taken up exercising, and I think my personal trainer, I keep telling her she wants to kill me, not help me get better. But obviously, I will keep telling myself I'm depositing something to my health bank later. Thank you so much, Yeyenta. I think we have 1 or 2 more questions, and then I'll see if anybody's got a question for us to answer. Okay. Now, in relation to diabetes, because obviously my specialty is diabetes and hypertension, we've covered hypertension in terms of being a risk factor for atrial fibrillation. How is diabetes linked to atrial fibrillation?
Okay, so diabetes in itself, is, in as much as it is a disease of blood sugar, it's actually a heart condition. Okay, so the fact that people have diabetes, you know, it makes your heart work harder, because your blood gets thicker and your blood is working a lot harder. So if you have diabetes and your blood's already working, your heart rather, remember that heart, that's a pumping machine, is working really hard to pump that blood upwards. And instead of pumping at that regular pace, it's doing this. And it's not really doing it frequently as it should, or it's doing it really rapidly. And then you have a pool of that blood, your risk of developing a clot increases even more, much more than any other person. So that's how diabetes is linked to your risk of increasing atrial fibrillation and therefore your risk of having a stroke. So what happens with a lot of people, especially people who sometimes we don't really think about our health and how it's all connected. So all these things are connected in the long run. And because, as we've already talked about perception of health before, in this session. So normally you would just have you would think everything is fine because you haven't got a symptom yet to attach that or to peg that illness on. You think you're fine. And so if you don't realize it, you wouldn't know that you are already having complications, not just of your diabetes, but complications of the heart. And complications, therefore, and increasing risk factors of therefore developing a stroke. So I've had a lot of people who've said, oh, this person had had diabetes for years, and he's been okay, but now he's just suffered a stroke. Well, that stroke didn't just happen. Things have been happening in the body, gradually over the years to get to that point of then having a stroke. So remember that health economy and that bank account, little things have been happening. So rather than making deposits, we've inadvertently, without knowing it, been making withdrawals until we become bankrupt in our health economy. And then you have suffer a stroke, suffer a heart attack, or suffer even more complications of diabetes, such as losing the eyesight or losing feelings in the extremities, in the fingers and the feet, because we've not really been looking after our body the way we should. So it's really important that we try to do things like this. So thank you so much, Tonye, for putting things like this up, because it helps us to become more health literate. And these are things that I think, 20 years ago, we weren't as health literate or concerned about our health as we are now. So, really thanks to you really for, giving us the opportunity to have discussions such as this and reminding ourselves about what's important.
Sorry, if you're, you need to mute, I don't know. I need to find who that person is. Mercy, can you mute your, I've done it. Thank you. Sorry about that.
That's okay.
The joys of Zoom. Yeah, right. So yeah, sorry about that. That just caught you in the middle of your conversation. We are making obviously healthy deposits, and I think from what you said, we need to make healthy deposits rather, not withdrawals. And I think that's my takeaway. Every action you take, you need to ask yourself, is that a withdrawal or a deposit in the right direction? Now, lastly, you talked about the treatments. How do the treatment of atrial fibrillation, how do they improve the chances of reducing a stroke? What exactly do they do? I know what they do, but in simple terms, how does that? Because people say, oh, I don't see a difference. I think explaining to people what it does on the inside of the body would actually help them to understand, or if they don't have atrial fibrillation, don't have a mom or a dad, or they know the medications, then obviously they'll be able to explain better.
Yeah, absolutely. So the main treatment for atrial fibrillation, the main treatments are medications that would slow your heart rate down, okay, or at least slow it down enough for your heart to be able to function normally and to avoid that, erratic fast heart rate, or medication that will correct the heart rhythm. So I said there are two types of atrial fibrillation: the one that is a very fast pace, beating of the heart, and the one where it seems to be skipping beats. Okay, so there are medications for those to help to correct the heartbeat, the heart pattern, and to help to correct the rapidness or the quickness of how your heart beats. Now, there are other drugs called anticoagulants, which also are used not to treat atrial fibrillation, but to prevent you from having a stroke. Many people know these drugs as blood thinners, or they call them blood thinners. In reality, they're not blood thinners. They don't thin your blood. What they do is that they prolong the time that it takes for your blood to clot. Okay, so if you think about it, I've talked about when you have atrial fibrillation, that pumping machine, which is your heart, becomes ineffective at pumping the blood out of your heart. And so you have a pool of blood lying within your heart. That pool of blood makes it, in medical terms, we call it stasis. Stasis means stagnant blood. Okay, so, or it's not moving as quickly as it should. And when you have blood that is not moving or free flowing as it should, that's a perfect condition for a clot to form, isn't it? So this is happening inside the body. Think about when you have a cut. Okay, you have a cut, and there are certain factors within the blood that make the blood clot so that we don't bleed to death. Okay, this similar thing happens in the body as well. Okay, so that when there's a certain amount of blood, the clotting factors get activated and a clot forms. Now that clot, as I mentioned, can travel because it's right there in the atrium, in the ventricle and atrium. It goes right up and it can go into the brain and therefore cause a stroke. Okay, so what the anticoagulant, or in layman's terms, is blood thinners, what they do is that they keep the blood flowing freely so that it doesn't clot. Okay, so it prolongs the time that it takes for the blood to clot. So those are anticoagulants. Okay, and if people are on anticoagulants, they need to know that they are on anticoagulants. So you may not notice anything. It would not necessarily stop you from having a fast heart rate. It won't stop your heart from beating irregularly, but it's certainly reducing your risk of developing a stroke. So whether or not you feel any different, or you know somebody who is taking these medicines, please do encourage them to keep taking the medicines.
Yeah, there's a lot of misconceptions that we tend to prescribe medications just for the sake of prescribing medications.
Yeah.
But I think that's a very wrong misconception, because we try not to prescribe medications, but if you are at risk of certain things, the reason why we prescribe the medications is not because we doubt your faith in God, it's because we're trying to help to, keep you healthy so that you can actually live to your maximum with good quality of life. Like Yeyenta said, that things like diabetes and strokes that result as a result of a combination of things like diabetes and hypertension can actually lead to stroke. And it's a worse type of stroke than somebody who doesn't have any underlying conditions. I don't know if anyone's got any questions. I've looked at the chat box and there is no questions there. So I don't know if you've got any advice for our listeners or people who are going to catch up, or the video will be shared later on. Do you have any advice for people? And if people have questions, please use the chat box and I would ask Yeyenta, Dr. Yeyenta. I have to remember she's a doctor, sorry. Yeah.
That's fine, I'm still Yeye.
Yeah. Do you have any advice? I
do, actually. So my advice is, a lot of my work currently is about prevention. And atrial fibrillation is about preventing, this talks about preventing not just atrial fibrillation, but actually preventing a stroke, which in the in people of Black heritage or Asian heritage, you have a lot more incidents of hypertension, a lot more incidents of stroke. Okay. And there are certain lifestyle factors. If there's anything to take away from today, is lifestyle factors that we can change to prevent us from developing these illnesses in the long term. Now, there are things that we could do. When we are young, I consider myself young, we work long hours, okay? Long hours is actually one of the preconceptions for our heart working harder than it should. When you work long hours, you're less likely to sleep early. Okay, you sleep late. Sleep deprivation, again, puts strain on the heart. Okay, so things like those, and again, atrial fibrillation can also be caused by psychological stresses. So for people who have a real, maybe sometimes bereavement, or you're going through a prolonged period of psychological stress or trauma, it can bring about atrial fibrillation. So these sorts of stresses, if we can find ways within our very busy, hectic lifestyles to try to reduce the events and the chances of those things happening so frequently, we will do well in reducing those stresses. Now, another way of reducing those stresses is physical activity. Increasing how much you exercise, increasing how often you move your body, releases good hormones into your body and helps you relax. Okay, and those are good ways to distress. Okay, so if you're going through psychological trauma, and sometimes you feel tired, you don't feel like exercising, but the irony of it is actually that even if you're tired, do something, that go for a walk, go for a long walk. You may not feel like running. Most of us, especially, people of Black heritage, we don't feel like running. Some people say, I don't want to run when no one's chasing me. Okay, then go for a walk, go for a long walk. It doesn't have to be running. Okay, it doesn't, you can do gardening. You can do something else that doesn't have to fit into the, going to the gym model of physical activity, but just do something. Keep moving, keep doing things and make it something that would fit in with your lifestyle. Okay, if you walk your children to school, or if you drive your children to school, maybe consider walking them to school instead and making it regular. Okay, so that would be my advice. And if you work long hours, look for things that would prevent you, or would look for maybe a job that would be less stressful. Okay, somebody mentioned something, and one of my friends mentioned something on Facebook a few weeks ago, and that struck me. And she said, when we have stopped looking for money or working so hard to get the money, may we not then begin to work so hard to achieve good health? And that's actually very true, because during our working lives, we work so hard, we work long hours, we sleep late, we wake up early, and then, but that's all I've been talking about your health economy. And then you get to 65 and you just hit the floor because you've been working your body really hard up until that point. So my advice was this: take life easy. If we want to enjoy retirement, enjoy the other side of life, what we do on this side really, really does matter. Within this life, I said the other last side of life. I didn't mean death. I meant.
I mean before 65 and after 65. Yeah. And if anyone's listening and is above 65, obviously it's not the end of the road. Corrections can be made, right? Yeah. Thank you so much, Yeyenta. I have looked and there are no questions. I'm going to give the last 5-minute call if anyone has got questions. Some people missed the start. I will make the recording available on the YouTube channel. So if you want to catch up or share with your family, then please obviously just check after 6 or 7 o'clock tonight and it will be on there. But if I know you personally, I'll probably send it to you. It's been a very interesting conversation around atrial fibrillation. And I'm just going to share a quick story. It's not really a story, it was a true happening of something that happened at work on Thursday. So I had this colleague of mine, and she has given me her permission, I obviously would not say her name, who just didn't look right. I had a patient to see, and she was one of the health, I wouldn't say junior clinicians, didn't look right, in her 50s, I quickly saw my patient and went into her. She's been having this chest pain for about 3 weeks in and out. She looked like she was about to hit the floor. And I said, you know what, you don't look right. We quickly got out the blood pressure machine, was a little bit low, checked her pulse. When I checked her pulse, it was irregular. So we ran a quick ECG, like you said, so everything fits in. It came out that she was in what we call fast AF. The fact that she was having really crushing chest pain, we had to whisk her in an ambulance straight to the hospital. Luckily, it hasn't led to anything. She's come out with a bag full of medications. Why am I saying this? I'm not saying this to scare anyone. She did have diabetes. The reason why I'm sharing it is because she did have diabetes, and for some reason, there was some disparity between your diabetes is somewhere in control, so there isn't really any need for you to take medication. And we have a target for everyone. We have a number, we have a target, but if you are diet control, we still really sometimes would encourage people, depending on what their diabetic number is, to still take medication and do that alongside the diet. But that didn't happen with this lady. Herself and the clinician, thought that the control was good because her, what we call HbA1c, which tells us about how much sugar is within the red blood cells, was somewhat controlled. But in my opinion, it wasn't controlled. Long story short, she's ended up with atrial fibrillation, she's got angina, and now she's got diabetes, which obviously is increasing her risk factor tremendously for a stroke in the future. She's only 55. Can this be corrected? Hopefully, yes, the medication would help. Why am I trying to say this? Is if you do have, especially people of the BAME community, I think they're moving away from that terminology, the Black and the Asian population. If you have diabetes and hypertension, we are mostly the culprits that do not take the medication, whether we like it or not. If you have medication, you've got high blood pressure, your doctor has told you you've got diabetes, do not take it for granted and say, I'm trying everything. Please continue to try the exercise, continue to try the diet and lifestyle. But if they give you medication, please take some water, drink those tablets, because they would help to prolong your health. As a Christian, I always believe that everyone has a purpose in life. But if your purpose is cut short because of a fault of yours, in quote, not really fault, or a lack of knowledge, then you're not able to fulfill your what God has put you here for. So that's my short take. Like Yeyenta has said, make deposits, not withdrawals, into your health bank, because that would actually help us, to live healthier lives, right?
Yeah.
On this note, no one has any questions. I've checked over and over again. Diabetes Consult is a company that we formed. It's helping people with diabetes, hypertension, to actually reduce the complications from diabetes. We are officially launching sometime next month. So obviously, if you've got any questions, feel free to email us. On the landing page, there's information on there. You can always drop us an email. But when we launch, we will let you know. And we have a variety of clinicians, people as amazing as Yeyenta, who will be there to be able to help people living with diabetes, hypertension, and a whole lot of chronic diseases. So thank you again, Yeyenta. I have to address you properly, Dr. Yeyenta Osasu. Thank you so much. It's extensive work. I don't know how you put 3 years of your life into studying atrial fibrillation, but obviously it's paying off. Thank you so much. And I have to say thank you to all the guests who've come on to listen. You've taken time out of your Sunday schedule, your Sunday roast, or your Sunday jollof rice, if you're Nigerian, or whatever you're eating, to come in and listen to this session. Really, really appreciate all the time that you have. Thank you so much. And I'm going to end it here.
Thank you for having me. It's been really great having all these people and having you as well, host. Thank you.
Thank you. All right. Have a good afternoon, everybody. Take care. Bye.
All right.